All right, good evening, everybody. It's so nice to have you here for our very important chat about PSYPACT today that I know is of interest to so many. I am Jennifer Doran. For those of you who don't know me, I'm the CPA president. I'm joined by Dr. Derek Fenwick. Derek, do you want to say hi?
Hi, everyone. I am part of the executive board for Connecticut Psychological Association and current secretary, so welcome.
Thanks. So we're going to be hosting the event tonight. We're going to turn it over to our speaker in just a minute. And Derek and I will be monitoring both the chat and the Q&A. So there will be time for Q&A at the end of the talk. You'll have the opportunity to unmute and ask questions. Feel free to also put them into the chat or the Q&A feature as we go along, and we will kind of keep track for when we get to questions. I am going to introduce Janet Orwig, who is the Executive Director of PSYPACT, here to talk with us tonight about our access to PSYPACT starting October 1st, and hopefully you will have all your questions answered about what we need to do and how we need to do it to kind of join PSYPACT and have that capability. So Janet, thank you so much for being here tonight, and I'm going to pass to you.
Thank you. Thank you very much for allowing me the time to spend with you this afternoon or evening, I guess. I did want to talk to you a little bit about PSYPACT. We're going to take a road trip, so I hope everybody has some snacks to take along on our road trip as we go along. So if you're going to have a road trip, you've got to kind of look at the road underneath. What's happening with the road. So PSYPACT got started by the Association of State and Provincial Psychology Boards, and that is the association made up of all the licensing boards for psychology. It has 65 member jurisdictions because it does include the US and the territories and the 10 provinces of Canada. And it is the organization that works with the licensing boards to help try to have consistency across all of the boards and works with those members. And ASPPB has a long history of dealing with licensure portability going back to the 80s with the Agreement of Reciprocity. And what that did was allow, if you were licensed in one state or province that was a member of the Agreement of Reciprocity and had been licensed in that state for 5 years, you could go get licensed in another member of that Agreement of Reciprocity. But the agreement required that the licensing board's statutes be exactly similar. They had to have the same education requirements, the examination requirements, the supervised experience requirements. And as time went on, different laws were changed. So as you know, a lot of the, jurisdictions at one time, the Agreement of Reciprocity required that you had an oral exam. And when states started dropping that, they had to come out of the agreement. And when postdoc years went away, came out of the agreement. So in January of 2020, the Agreement of Reciprocity was sunsetted. At that time, it ended up with only 3 jurisdictions left in it. And 2 of them were Canadian provinces and 1 US state was left. Everybody else had changes that didn't keep them being able to be in there. So what ASPPB did in 1998 was create the CPQ, or the Certificate of Professional Qualification in Psychology. And it worked very similar to the Agreement of Reciprocity, except instead of the state having to meet the requirements set out in the agreement, the individual did. So in order to get a CPQ, you had to meet the education, experience, and examination requirements. And what that allowed you to do was to go get licensed in another state that accepted the CPQ, and you didn't have to go redocument all of your information about education, examination, and supervision. And it sped up the licensure process. ASPPB also is a credentials bank that's available to everyone to bank your credentials electronically, and they are stored and primary source verified. And they also have the Psychology Licensure Universal System, or the PLUS, which if a jurisdiction is utilizing that system for all of their applications for licensure, you would go through the PLUS, fill out an application, and get your packet of information is then sent to the licensing board for approval. So ASPPB has a long history of working with licensure portability and its members around that area. So we're going to talk today about interstate compacts, because that's what PSYPACT is. And so what is a compact? It is a simple tool. I know when you look at the language for PSYPACT, it doesn't seem like a simple tool, but it really is, and that it helps provide a contract between the states that are part of that agreement. It also gives a little more teeth because, as you know, it has to go through the legislative process. So it has to be enacted in a state, but that also gives that contract between all of the states. And that's kind of why it's really important that the model language that gets enacted in all the states is the same, because it's that contract between the states. It allows the state to still keep its state sovereignty over the issues that belong to the state. PSYPACT doesn't impact the licensing of anything like that. It's just strictly dealing with the elements of PSYPACT. So it's been around for a period of time. Compacts exist back to Revolutionary time. There it is in the U.S. Constitution. And since 2016, there's been about 214 separate pieces of licensure compact legislation enacted. Typically, states have from 20 to 40. My research on you guys show that you have probably around 35 compacts that vary. Most of them deal with border issues, transportation, a lot around water, if you share lakes and cross state borders, how you're going to deal with those. But more recently, you're starting to see professions utilize interstate compacts for mobility. And nursing has probably been around the longest. They did a compact many years ago, but you're seeing that with a lot of the professions right now. So currently, medicine, nursing, physical therapy, occupational therapy, speech and audiology, emergency medical services, counseling, all have compacts along with, of course, psychology that are enacted. Now, not all of those are up and running. They're still working on some of their stuff, but a good many of them are. And then you're looking at some of other professions are still working on theirs. Social work is working on a compact. They hopefully will be able to put it out to for the legislative session next year. Physicians' assistants are working on one. They're expecting to start trying to have that introduced next year. So you're seeing compacts being used in a lot of the other licensing fields. But the best known compact, and I think probably gives a really good example, is the driver's license compact. And what that allows you to do is get in your car, drive to another state. You don't have to stop at the border, get another driver's license, and go forward. It is important to kind of note with compacts that there are very few of them that are in all 50 states. And I think everybody probably thinks that the driver's license compact is in all 50 states, and it is not. There are about 7 states that don't participate. My home state of Georgia is one of those, which basically means, from what I understand, that if you were driving in Georgia and speeding, your points might not get reported to your home jurisdiction. Not encouraging speeding in Georgia, but that's one of the things about being in a compact. But it is important to note that not all compacts are in all, the compacts are in all 50 states. Well, we're here to talk about the Psychology Interjurisdictional Compact, or PSYPACT as we like to affectionately call it. And so a little bit about the timeline. As I said, ASPPB is made up of the licensing boards for psychology. And in around 2010, the licensing boards approached ASPPB and said that they needed some help in regulating telepsychology. They knew it was happening across state borders and they weren't quite sure how to regulate it. So ASPPB created a telepsych task force that was tasked with trying to address how to regulate telepsychology. And they worked on it from 2011 to 2015. And at that time, they came out with the compact and they provided it to the board of directors, and the language was approved in February of 2015. That was too late to really get started in the 2015 legislative session. Most of the time you do that early in January. So we didn't see the first state enact PSYPACT until 2016, when Arizona came on in May. In April of 2019, Georgia became the 7th state. And why that is important is that every compact has a magic number, a number that of states that have to enact it in order for it to become effective. For PSYPACT, it was the 7th state. So once the 7th state became enacted, PSYPACT could stand up, the commission could be formed. And they had the first commission meeting in July of 2019. And we started working on getting it implemented and being allowed to have psychologists practicing under the authority of PSYPACT. And we opened applications up in July of 2020 and issued the first APIT on July 6th of 2020. And the APIT is the authorization to practice interjurisdictional telepsychology that you have to have in order to practice under PSYPACT. So why did the task force decide on a compact? Well, a lot of different reasons, but part of it was the variations in laws across the jurisdictions. I'm sure if anybody's ever tried to apply for licensure in another jurisdiction, you see that their laws are different than your current state. And also, it also helped address the disciplinary processes across jurisdiction lines. The compact very plainly spells out how a discipline action is processed by the two states as you're going forward. And then it also helped address inconsistency in licensure requirements or in looking at, because it established the threshold for what would be needed as far as applying under PSYPACT. PSYPACT is designed to regulate the day-to-day practice of telepsychology across state borders, as well as the temporary in-person, face-to-face practice of psychology for up to 30 days annually. When PSYPACT was originally presented back to the ASPPB membership, it only contained actually the telepsych component, and the membership asked that it add in the temporary in-person face-to-face component, because the requirements and allowances for temporary practice across the jurisdiction vary greatly. Some will allow you to come in for 5 days, 10 days, 30 days. Some will allow you to come in at all. So this allowed to have a standard amount, 30 days coming in face-to-face. It does not mean 30 days in or 30 days over a total of all the jurisdictions that are part of PSYPACT. It means 30 days into this one, 30 days into that one. It is not meant to set up a permanent in-person practice. If you're going to do that, you would need to still get a license in that state. So some of the benefits of PSYPACT is that it does increase patient care, continuity of care. One of the things that we started hearing right when everything was being shut down for the pandemic was from the universities, and how were they going to continue care with their students as they were needing to send them home. And that's really kind of exactly what PSYPACT was designed to address, was how do you do that continuity of care. It also provides a higher degree of consumer protection, because it does spell out the disciplinary requirements and how that is handled. And it provides the readily knowing legal requirements going back to those temporary notices as the how many days. You now know you have 30 days. So it does help with providing that. So the start of it, like I said, we had to have 7 states enact the legislation. Once that happened, the commission was formed, and the commission is the governing body for PSYPACT. And the commission is made up of a representative from each of the PSYPACT states. And they come and they represent their jurisdiction, as well as help manage the day-to-day components of the compact. The work of the commission, one of the things that they did in that very first meeting back in July of 2019 was they wrote and adopted the bylaws. They promulgated about 5 rules at that meeting that allowed us to get started and proceed to be able to get up and going. We now have a lot more rules than that. They have also created and established the policies and procedures. They approve an annual budget. They have an elected executive board, and we have established standing committees. And as it stands right now, all of our committees are stood up and are meeting quarterly to conduct their business. So the current status of where we stand right now, we do have 33 jurisdictions that have enacted the legislation, and we have of that 33, 31 of those are effective. You guys will become effective on October 1st, and Rhode Island is tentatively set to become effective on January 1st, 2023. So that's the 2 that are missing from the 33 that have enacted the legislation. So hopefully those will be, you guys will be joining us in just a little over a week now. So we're looking forward to that. We still have active legislation in Massachusetts, Michigan, and New York. Michigan, we are sitting in the Senate. I think we are the second reading in the Senate, and once we do that, if we pass there, we will go to the governor's desk. Massachusetts hasn't moved in a while, so I'm not really sure if we're going to do anything before the session ends. And New York, even though it got introduced, really didn't move any. We got introduced with, I think, medicine and nursing as well. New York doesn't have any compacts, any of the licensure regulatory compacts. So we felt this was a really good step just to get our foot in the door. We're hoping to see some more progress and be able to work with them a little more next year and maybe move a little further than we did this year. I just think this is a really impressive slide with numbers. As I said earlier, we started in 2016 and got our first jurisdiction then. It took us until 2019 to get 7. And last year in 2021, we saw 22 bills introduced and 12 of those got enacted. This year so far, we have had 9 introduced and 6 of those got enacted. So we can see a huge momentum and interesting growth from where we started to where we are now. So anytime you're taking a road trip, you have to have some points of interest along the way. So as we're going to talk a little bit about some of the PSYPACT terms that are important to know. I think everyone knows telepsychology is the provision of psychological services using telecommunication. Home state is the state where the psychologist is licensed and where they are providing the services from when it comes to telepsychology. The receiving state is dealing with telepsychology, and that is where the client or patient is located when the services are delivered. The distant state is works when you're doing temporary in-person face-to-face practice, and it is where the psychology is, the psychologist and the patient would be physically present in that state, and that would be your distant state. As I talked about earlier, the APIT, or the Authority to Practice Interjurisdictional Telepsychology, is the authority that you must have in order to practice under PSYPACT, and that is issued by the PSYPACT Commission. The temporary authorization to practice, or the TAP, is the authorization issued by the PSYPACT Commission that allows you to conduct that in-person, face-to-face practice. So how it works under PSYPACT. A psychologist is practicing from your home state into the receiving state under the authority of PSYPACT, and you are subject to the receiving state's scope of practice. We had a legal opinion about what that meant, and then we also have had the commission expand on the rules, what it is meant by the receiving state scope of practice. So under Rule 4.10 that can be found on the PSYPACT website, it does spell out what that means a little in more detail. But for the purpose of regulating telepsychology through PSYPACT, the practice of psychology is deemed to take place where the practitioner is located and licensed. And part of the reason why it is different, and it's different than the way most of the other professions do, is that because we only focus on telepsychology, we needed that home license, that license in order to be able to do a discipline if something came up. And so that's why it is based on the practitioner being in their home state where they're licensed, and that is where the practice takes place from. How it works is that if you are a psychologist sitting in your home state and you have the APIT and the authority to practice under PSYPACT, you can do telepsychology into any of those other compact states without having to get a license in those states. Your authorization allows you to practice, if you're sitting in Connecticut, would allow you to practice into those other 31 jurisdictions once you guys become effective without having to get a license or do any kind of notification to those states. So kind of talking a little bit about how it works again, the states enact the legislation, the commission was formed, any psychologist that wants to practice under the authority of PSYPACT must apply to the commission. And to get the APIT, or the authority to practice interjurisdictional telepsychology, you will need to get an ASPPB e-passport, which is one of the requirements for the APIT, and that will allow you to practice telepsychology into a receiving state. If you want to do the temporary authorization to practice, or the TAP, you will be required to get an ASPPB interjurisdictional practice certificate. That is one of the requirements for the TAP, and that will allow you to conduct temporary in-person face-to-face practice into a distant state. So a little bit about the requirements that the commission has to get the APIT is that it does have to be an acceptable graduate degree in psychology, must have a full unrestricted license in a compact state, cannot have had any adverse history of actions, any adverse actions, and you must have, like I said, that current active e-passport and then meet any other criteria established by the commission. The e-passport, I think it's really important to kind of do a little bit of housekeeping here, a little bit more explanation. So when I talked about earlier, PSYPACT got started because ASPPB and the ASPPB members, but when the PSYPACT Commission was formed, PSYPACT became its own separate entity. It is a semi-quasi-governmental agency. It is no longer part of ASPPB. It is a separate entity. However, that being said, the e-passport is an ASPPB certificate, and it is vetted and reviewed by ASPPB, and the commission and ASPPB have an agreement that works out the services that are provided by ASPPB to cover the e-passport as well as the IPC. But the PSYPACT Commission is a freestanding, like I said, semi-quasi-governmental agency now because it is made up of states and state members. So the requirements for the e-passport is that you must have an APA or CPA or joint designated program. Your degree must have come from one of those. And joint designation was a program that ASPPB and the National Register did where they reviewed programs. It was in effect from 1981 until 2018. And if you're not sure about whether or not your program would have been joint designated, information is provided on the ASPPB website, and the complete list can be found there. As well as the other, you must have a full unrestricted license to practice psychology in a home state, which is a compact state. You must have a passing score on the EPPP, or the exam for professional practice in psychology. You can't have a history of any adverse actions. And then there's a series of attestations that you will talk about, that you will provide information on, that you have to attest to, and then meet any other criteria as defined by the rules of the commission. And also will need to be aware of and be held to the guidelines for the practice of telepsychology. And the guidelines for the practice of telepsychology were written with ASPPB, APA, and the trust. And they kind of cover the elements that you need to consider when you're doing telepsychology that might be outside of a normal face-to-face practice. So those are the requirements for the e-passport. So for the temporary authorization, it is very similar to the e-passport requirements, except instead of, to the APIT requirements, except for this one, you have to have the interjurisdictional practice certificate issued by ASPPB, and all of the other criteria are the same. And again, the IPC is an ASPPB certificate, and that it's covered under that agreement that the commission and ASPPB have. And the IPC requirements are very similar to the e-passport requirements, with the exception that you do not have to show proof of passing the EPPP. I do want to highlight a little something here, a couple of things. In the IPC, or the Interjurisdictional Practice Certificate, used to be a freestanding certificate. There were 7 states that used it to recognize or to help with temporary practice. It had always been a certificate dealing with temporary practice. Due to it being part of PSYPACT and afraid that it was going to be confusing, the freestanding certificate was sunsetted by ASPPB in June of 21 or 20. And so anyone that had an IPC at that time, it was kind of put in a parking lot and left over there, it didn't go away. And as your state comes on, if you have an IPC, you can reactivate it if you are interested in pursuing the TAP application. We will reactivate it, and you don't have to reapply, and we'll just start it and then start your TAP application from there. As being part of that, if you did not come from an APA, CPA, or joint designated program, but already had an IPC, you were deemed grandfathered in to have met that education requirement because you already had an IPC. Doesn't apply for any passport, but it does because you already had an IPC or deemed to have met that education requirement. For both the IPC and the e-passport, there are two exemptions. If you were licensed before January 1st, 1985, you are deemed to have met the EPPB requirement for the e-passport. You do not have to provide us information about your exam if you were licensed prior to 1985. If you were licensed in that same time frame prior to January 1st, 1985, you are and come from have a degree from a psychology program, you are deemed to have met the education requirements for APA, not having to meet the APA, CPA, or joint designated program. If you have any questions about that, we can talk about that further when I finish this, or like I said, you can have my contact information at the end and we can talk, you can email me at any time regarding that. But that are the two exemptions right now for meeting that educational standards, or also the EPPB. So now I'm going to talk a little bit about how to apply, because I think you guys are, with you coming on in October, that's the door's about to be open. So wanted to talk and kind of walk you through the application process. Like I said, in order to practice telepsychology, you have to have the authority issued by the PSYPACT Commission. And in order to do that, there are two things you have to have. You have to have the ASPPB e-passport and the authority to practice interjurisdictional telepsychology, or the APIT, granted by the PSYPACT Commission. I know I have said this over and over again, but it is, we have people that think that once they have the e-passport, they're done. And it is very important, because the only one that can grant you authority to practice under PSYPACT is that APIT that is issued by the commission. So the fees, if you are wanting to do the telepsychology component, the authority to practice interjurisdictional telepsychology has a $40 application fee. And at this moment, it does not have a renewal fee. The reason I say at this moment, there is a rule that is out for public comment where renewal fees may become initiated after the first of the year. So right now there isn't one, but there may be one by January. The e-passport has a $400 application fee with an annual renewal fee of $100. If you're wanting to practice the temporary component, you need the TAP, and that has an application fee of $40, not 400, $40, with no renewal fee at this time, but it is also part of that rule that is out for public comment. So there could be a renewal component after the first of the year. The interjurisdictional practice certificate, or the IPC, has a $200 application fee with an annual renewal fee of $50. So the first stop on your application tour will be PSYPACT.org, and you can go there and start your application. What it's going to do is take you over to PsyPro, and PsyPro is the software that ASPPB uses for all of its programs. So if you have a credentials bank or a CPQ, or have ever done a PLUS application, or ever requested a score transfer, you may already have a record in PsyPro and can just enter your email address and your password, and that will take you in. If you don't remember your password, there is a forgot your password option, and you can click on that. But if you've never done a service with ASPPB at all, you would need to register as a new user. Once you have registered, you're going to get come to a main dashboard, which is going to be my activity summary. And as you can see in this example, there is no history under my application history. It's brand new. And on the right-hand rail, there is if you're wanting to practice, we're going to talk mostly about the e-passport and the APIT application. The IPC and TAP are the same process as we're going through. You would just click the IPC TAP application instead of the e-passport APIT TAP application, but I'm going to just kind of walk you through the e-passport application as we're going through. So you would click on the right side rail and click that e-passport/APIT application. One of the things that we try to do is to make this as easy as possible, that you're applying for both the e-passport and the APIT at the same time. You are not having to come back and start another application after the e-passport. It flows pretty seamlessly between the two. So once you have clicked that, you're going to get kind of an informational sheet that talks about what is PSYPACT, what do you need to do to apply, how do you maintain it, and just some general information along with some contact information if you have any questions. Once you've read that, there's a little blue next button to go on. And this will bring up the list of states that are current participating. Very small list here. My list is too long to get them all, and so I just have kept a shorter list. But once you become effective on October 1st, your Connecticut will be added to the list. You'll be able to click yes, and then you can start your application. That's going to take you to your cart. And what should be in your cart is an e-passport application that says $400 and an APIT application that says $40. If you have anything else in there, please use the red, unless you want it to be there, please use the red X to get it out. Sometimes the system gets a little happy and it might put in a couple of e-passports and you really don't need but one. So just use the red X to take it out. That should be all that you have in there. You do not need a score transfer or a credentials bank transfer for this service. You're going to start your application. We're going to pull your credentials bank information. We're going to pull your score information. You don't need to request any of those other services. Just the e-passport and the APIT should be all that's in your cart as you go forward. So after you do the payment, it's going to come up with kind of a thank you page and some next steps. What should happen then is that when you go back to your My Activity Summary under My Application History, you're going to see you now have an e-passport. It's under Data Entry and Verification, and you're going to go to the blue Edit button and start your application. Do not open up the Credentials Bank and look at all that. That is a lot more information than is needed for the e-passport. If you want to come back, every person that applies for anything with ASPPB automatically gets a credentials bank that started. So if you want to come back at some time and complete your credentials bank, you can, but you don't need to do that for this purpose. There's a lot more stuff in there than is required for the e-passport application. So when you click on the edit button, it's going to bring up the elements. So you have your demographics record, your licensure record, education, examination, your conduct section, that acknowledgement section that we talked about, and then submitting it for review once you have completed all of the parts. So you're looking at the exam section. One of the things that I just kind of wanted to talk, I'm pulling up, I'll talk a little bit about the exams in the education section. The exam section required, like I said, verification of the EPPP unless you were licensed prior to January 1st of 1985. If you were, just go through this and you don't even have to fill out any part of it. ASPPB maintains the repository for all EPPP scores. We have them going back to the 1960s. So all we need here is just some general information, kind of a general date. You do not need your candidate ID number. We can pull that up. But what we do need is if you took the exam under another name, we're going to need that. If for some reason we can't locate you or match you up with a record in our system, we'll be back in touch to get that. But you most of the time do not need a candidate ID number. We should be able to pull you up from the computer records. And then the education section, you're going to open it up. And it's going to bring up a page. Now, one of the things that's great about the system being all tied together and being able to move from one application to another when you're looking at different things is that you're able to do that. The bad part is that there are things in this section, in the education section, that is really not needed for the e-passport application. They're needed more for some of the other applications that ASPPB provides. So, but when you put in your institution, and there should be, it's a pretty robust database. So your school should come up with some other information about designation or accreditation, but you're going to see down there where it says Director of Program. In some of the other programs, applications, we need that in order to verify the program or the degree with the director. We do not need that for the ePassport application. So if you want to get it verified and know who to send it to and all that, you can do it. It'll become part of your credentials bank and moving forward. But we don't need that for the ePassport application. So if you don't, and it's going to require you to put something in this field, you can put your own email in there just so that it can get through the system. And it'll just send you an email about verifying it, and you can just ignore that. But it's going to require that. And once you have completed all of the fields that are necessary, it's going to allow you to submit that as complete. If you are sending it for verification, when you put in that information and hit complete, the system automatically sends an email to the person that you have listed in there to attest to your program, and they will get some information about doing that. And then staff would then follow up with a primary source verification call to verify your document, and then it becomes part of your credentials bank. So as you can see, once you've done that, you've got the degree and all of that. And in this section, it still says it's submitted for verification. So it was sent out to someone to verify. Talking about transcripts. So transcripts, in order to finish up your application, ASPPB does have to have an official transcript from your university for your doctoral degree. They can be electronically sent to transcripts@asppp.org, or they can be mailed, and the address is there. We are aware there are some schools that closed, especially the Argosy universities, and most of the schools that have closed, Parchment has those records, and this is a link to their website so that you can order those records. They can send them to us. Most of the time they are going to do it electronically. So it's really important to note that, like I said, it is part of your application. We have to have your transcript in order to go forward. So when I was showing you earlier about, go to the next slide. When I was showing you earlier where you have your different components, and the last one down at the bottom is submitted for review. And as you can see, there's nothing there to be able to do. There's not a blue link that says, hey, I'm ready to submit. That's because the transcript hasn't been uploaded. Until ASPPB receives the transcript and uploads it to your account, you will not be able to submit for review. Once ASPPB has received the transcript, you can see down at the bottom that it says official transcript. There's a checkbox and it says official transcript uploaded by ASPPB. And you now can see that the submit for review button is there for you to be able to do that. So we have to get that transcript and get it added to your account before you can submit for review. When a transcript is uploaded by ASPPB, you will get an email alerting you that that has been uploaded, and you can then come back in and log back in and submit for review. Right now, we are running about 4 weeks for processing. Sometimes when we add a new jurisdiction, we get a little bit behind just because there's a kind of a bump in application. So kind of bear with us, but hopefully we can stay pretty close to our 4-week processing time that we are doing now. What goes through with that is that the ePassport staff will review all the materials, grab all of the primary source documents that we need for like licensing and the licensing verification, things like that. It is then sent and reviewed by 2 separate reviewers. So that's kind of the process of going through, and then you will receive notification about your ePassport. Once you have that, you can see you've submitted for review. You can see down by your ePassport, it is now under ASPPB review. So that means that the staff is gathering those materials and it is being sent out for those 2 reviewers to review. Once you have the decision, you'll receive an email that says, congratulations, you have your ePassport, you're almost there. And you now need to go back in and work on your APIT application. So once you have that, you see the ePassport is complete. You'll now see on your right side rail, you have a mobility number, a renewal date that is based on the ePassport date, and the issue date of the ePassport. The mobility number will be the same for all of them. All the certificates have the same number just to make it easy, so you don't have to remember anything. So if you get an ePassport, an APIT, an IPC, a TAP, they're all going to have, you just refer to that one mobility number. So once you have submitted and you can get this information about your APIT, you start that. And the biggest thing with the APIT is you'll go in and hit the edit button and start that application. The biggest thing about the APIT is to be able to declare your home state. And as we talked about earlier with the application or the renewals, or when we were talking about the processes, your home state is the state where you were licensed and where you are going to be providing services from. That is a PSYPACT state, and that's the state you're going to declare as your home state. There's just some sections in here to verify your licensure record, education record, conduct record. Those are all being pulled over from the ePassport along with the ePassport acknowledgement records. And then you would just click the edit of your home state. And that's going to be, when you do that, you're going to bring in here and you're going to add what your home state is going to be. Usually use the date of which you're adding. So just start your today's date and add that. And then from the drop-down menu should have listed all of the PSYPACT states. You can pick which one you are using. I'm assuming for you guys, it's going to be Connecticut, and would pick that from the drop-down menu. Once you have done that, that shows that that is complete, and then you can go ahead and hit edit and start submit for review. Right now, the APIT and the TAMPs are taking about 2 weeks for processing. They go through kind of the same process. Staff is going to grab their information, going to work at it, make sure we have the licensure verification for the license that has been declared as the home state, and that we also will then go in and put in the information regarding I'm blank for a second. We'll put in the information about the home state and move it forward for the 2 reviewers to look at. You will see that while that's in the process, I think now it says PSYPACT review and not ASPPB review. I just haven't updated my slides, but should be able to go forward. As you can see over on the by the edit button, there's a little one that says home state declaration. So let's say that you're finished, you've got everything you need, and you're practicing under PSYPACT, and you decide you want to move to another home state. This is where you would go back into PsyPro and change your home state. If you relocate to another state, if you do 6 months in one state and 6 months in another, you can go in and change your home state, and you'll just log back into PsyPro, go to your APIT application, and under home state declaration, make that change. And it'd be similar, very similar to what you did when you were doing the application. You'll see the history. There'll be a history down at the bottom of however many times you've changed your home state. Like I said, we will let you'll get an email letting you know how the outcome of your APIT application. We have a new step right now, and it may change and become part of the application, but prior to getting the final certificate for your APIT, we're going to send you an acknowledgement form that requires you to acknowledge about 5 things. One about home state, kind of how you can list your APIT, some other things like that that you'll initial and send back. Once we have that, you'll then receive an email back from us, and we do have a certificate that we send to you, as well as upload into your PsyPro account if you need it at a later time. It can be found under your licensure tab so that you can pull it down and take it if you need to show it to someone. I know it seems a little early to talk about renewing your authority to practice under PSYPACT, but I find that years go by really fast, and then some people may be on here that already have an e-passport because they're licensed in another jurisdiction. So I just kind of wanted to talk a little bit about the renewal processes while we are together. So as part of that, you will get a notice when your e-passport comes up for renewal. We send out notices 90 days, 60 days, and 30 days prior to the renewal date. As you can see in this example, on the right-hand side, you have your e-passport and your APIT date. This unfortunately is expired. It didn't get renewed in time, as long as the other renewal date. Oh, something else I'd like to point out is that the renewal date, the very first renewal date, is going to be based on the issue date of your APIT. We wanted to give as much time as possible. You really can't practice under PSYPACT until you have your APIT. So instead of basing it on the e-passport issue date, it will become based on the APIT once that is issued. So your renewal date will match up with that. Once you have started your renewal, you can, once you've received that notification, you can log in. There's a renewal button that will be by the ePassport. That is where you will do the renewing, not over picking the ePassport on the right-hand rail, but doing it in your application history by the ePassport. Some of the things that you need to do with it is to verify your demographic information again, update any licensure information. There are 2 questionnaires. One is basically, have you had any issues or things like that, kind of the same thing you do when you do renew your license. And then the second questionnaire kind of focuses on what you've done in the last year regarding telepsychology. Have you used the authorization? Have you, what states did you practice in? How many patients did you see? Kind of those kind of general questions. It also has the ePassport acknowledgements again, and then it has the continuing education component. And the ePassport is the only certificate that ASPPB issues that has a continuing education requirement. It does require 3 hours of continuing education in some kind of means. And it does have to be conducted during your renewal period. And there are, from what I can, from what I'm seeing, there are a lot of choices and variety out there to choose to meet those 3 hours. So some of the items that can be in there, it can talk about that it does need to be from an APA approved sponsor. It can cover anything to do with informed consent, security and transmission of data. We see a lot of ethics regarding telepsychology, some things like that in some of the courses that we are seeing. And then it does have to be, like I said, directly relevant to telepsychology. And these are some of the things. These are the categories that are covered in the telepsychology guidelines that ASPPB and APA and the trust wrote. So some of those areas that were covered in that are some of the areas that we have said meet the criteria for CE. So kind of talking about some things that might help as far as going forward, because we do realize that if you've looked at the model language for PSYPACT and the bill that got enacted in Connecticut, it's like 40 pages. It's very long, but it's still very general. And the commission, some of the things that it has done is work on those governing documents. So the bylaws cover, the rules cover. Like I said, right now we have out rules for public comment. We are considered, like I said, the commission is considered a semi-quasi-governmental agency. So everything we do is open to the public, as well as any rule changes we will make. They go out for public comment. They are out right now. There are 3 rules. Well, it's in one rule, but it's 3 sections that have been added to rule number 4 and rule number 5. That are out for public comment. They will be out until September 27th, and then the commission will vote on them at their full commission meeting on November 17th. The 3 rules that are out there right now, one covers the renewal fees, adding the renewal fees like I talked about earlier. The other one covers that acknowledgement form and establishes that must be completed in order to complete your application. And the other part of the rule is to establish an appeals committee and appeals process that we do not have currently at this time. So those are the 3 rules that are out there. You can get to them from the PSYPACT website, and we do encourage everyone to go and look at them. Please make public comment. We appreciate you taking the time to do that. But the governance documents that are here, especially the policies, talk about how to implement, may cover areas about how to list your APIT or your TAP, how to advertise it. There's just some general policies that are really very helpful to read through prior to working or under the authority of PSYPACT. We also have a verification directory. So what this allows you to do is that it verifypsypact.org can verify PSYPACT holders. It is, you can either search for an APIT or a TAP holder. It will provide, it's done by psychologist's name. I do recommend that when you select the method that you want to search by, there's a search button that's kind of spinning. Let it finish spinning before you put a name in, or it will give you, it won't recognize that narrowing name, and want to make sure that you add that in. But it will tell you where all this person is licensed, whatever the issue date was for their e-passport, their APIT, do they have a TAP as well, and provide their mobility number. This is the public verification that is used for insurance companies, things like that, in order to verify use PSYPACT holders. The PSYPACT website at PSYPACT.org does contain a lot of useful information. Like I said, it is where you will start your application process. It also provides information about all of the work of the commission. So one of the tabs is strictly the commission tab. Under that tab, you will find the list of commissioners, as well as any of their meetings. And as I said earlier, the meetings are all open to the public, and a link to attend the meetings are provided there. They're all via Zoom right now. Even the committee meetings are public. So if there's any of the committees that are working on stuff that you might find interesting, some of our committees deal with the rules. We have a rules committee, a finance committee, a requirements review committee. We have a compliance committee, finance, and then our training and PR committee, which works on updating our training materials as well as keeping our website up to date. So those are some of the committees, but all of their information is found under the commission tab. Under the authorization to practice, you'll find general information, questions about applying, about how to use the certificates or the authorizations. Also find the current map and that kind of information. The Verify, you can get to the Verify website here from the PSYPACT website or from the verifypsypact.org site. That is pretty much all I had on here to cover for tonight. I do want to highlight very much that ASPPB was the recipient of a HRSA grant, and that helped fund many of the activities that I presented tonight, and we've been very fortunate and very appreciative of that grant. It has helped get us where we are today with some of the services that we are able to provide. So I'm ready. If we can open it up for questions, and I thank you guys for all of your attention.
Thank you, Janet. I have a few waiting. I have a few that have come in, and anybody who wants to speak, please just raise your hand or request to unmute in the chat, and we can unmute you, especially if there is follow-up. But I'll kind of just go through the ones that we have waiting to start. So the first question was if information that is entered into the application will populate into the credentials bank, like if there's information sharing between those two systems.
There is. The only issue that we have seen, the information itself does, it populates between the two. The transcript, if you have a credentials bank record already, sometimes we have to go get that transcript out of that record and physically put it into the e-passport. So if you have one, it might be well to reach out and just let us know that you have a credentials bank and have started an e-passport so we can move that transcript over. Sometimes it does it, sometimes it doesn't. We've had IT working, can't figure out, you know, it sneezes or something. I don't know. We can't figure out why some people it works and some it doesn't. So just if it's taking longer, or if you already have a transcript with us, if you have it on file for a CPQ or something like that, we can move it over and you don't have to order a new one.
Okay. Does the transcript requirement apply if somebody has a CPQ and was licensed before 1985?
If they have a CPQ, we have to have a transcript for everybody. But if you have a CPQ, we probably have your transcript on file and we can just upload it to your e-passport application.
Okay.
But everybody has to, we still need a transcript even if you're coming under that exemption for 1985.
So we had a couple questions about what if you're licensed in more than one state and both states end up in PSYPACT? Do you have to keep the licenses in both states? Are you able to stop the licenses in one of the states? How would you recommend navigating these situations for folks with dual licenses?
So if you are licensed in 2 states and you practice out of both of those states, when you're practicing out of those 2 states, you're probably not practicing under CPACT because you hold a license in both of them. If you are going to be sitting in this one state and don't think you're going to be sitting in that other state at any time, then it's really kind of up to you whether to keep that license or not. If it's a CPACT state and you can do teleservices into it, if you ever want to have an office in that other state or go there physically, you would still need to probably keep that license. But I hope that answered that question. I hate to tell anybody to get rid of a license because I don't ever know if you might need it back to go back and you have to start all over again. But if you're physically only going to be sitting in Connecticut and want to let that other license go, you should be able to, as long as both states are still in CPACT.
If you had like physical offices in both states, like, right, like if you were in New York 2 days a week and Connecticut 3 days a week, right, when New York is participating, then you would want to keep the license in both
Correct.
states.
If you were sitting in both states, you definitely have to have a license if you're sitting in both states.
Okay. All right. Colette, if I, assuming that answered your question, but if there's any follow-up, just let me know, or we can unmute as well for you. Does having your ABAP bypass any of the requirements that are part of the application?
No.
Okay. How does insurance reimbursement work with PSYPACT?
You know, that is, I wish I had the perfect answer for that, and I don't, because it does depend on the state, the carriers, and all of that. You know, one of the things that did help significantly, and like I said, I think because compacts are new and people don't quite know what to do with them, and that applies in for insurance as well, is when CMS said, they came out with an opinion that said that compact privileges are deemed to be equivalent to a state license, that they're going to recognize them as equivalent to a state license. That helped a lot with providers. I think as you see more and more compacts come out, what I have been told, and this is first of all, we refer to APA a lot for this because they keep more involved with that kind of area. We deal more with the regulatory part. They deal more with the practice part. So we reach out to them a lot for insurance questions. But it would very much what I hear from the practitioners that I have talked with is to kind of handle it the way you do now. Contact the insurance company, tell them what you're doing, what codes and what point of service they want you to list, and get that kind of prior approval before going forward. But it's an education process, and some states were running into some issues and have had to provide that CMS letter as well as some information from the state boards about what it means. So we're open to helping any way we can. If you run into some issues with getting a private carrier to understand what we are, we strongly think that as more and more the professions start doing this, especially the bigger ones like medicine and nursing and some of those, the insurance carriers are going to start to understand compacts better. But right now it's just kind of do it the way you do it now, and just talk to the carriers on the case-by-case basis.
Can you clarify about where providers can be physically located with a license? So for example, we had a question, Maggie, I'm following up because I saw your follow-up to my original response here. The original question was being licensed in a compact state, being located in another state and practicing telepsychology into a third PSYPACT state. So is that allowed? For example, if you're licensed in Connecticut, residing in New York, and providing telehealth to Georgia, is that something that you can do?
No, you have to be physically sitting in Connecticut, and that has to be your home office, your home state. Then you can provide services into Georgia. New York isn't part of the compact at all. So if you're in New York, you would need to have the license in New York, but you wouldn't be able to practice under PSYPACT in your Connecticut license. You physically have to be in Connecticut.
Okay. Okay. All right. Maggie, let me know if there's any follow-up needed there. So that was helpful clarification for me too, because I got that wrong originally. Okay. Is there a contact at PSYPACT if people have questions when they're working on the application? How would they reach out?
I'll send you my slides so you have them and can send them out, but definitely contact me. My email address is jorwig@aspppb.org. But yes, definitely reach out. I'm happy to help any way I can. We also have on the CPAC website, a contact us form, which you can just go to. It's like at the top of the website and just put in a contact information. If there's any questions or anything like that, you can do that as well. I have 2 wonderful CPAC staff people helping me, so we will get back with you.
So each provider within a group or hospital department has to go through this credentialing process. Does a group practice or a hospital have to apply for anything to allow its providers to practice under PSYPACT?
No, just this, it's based on the psychologists themselves. The psychologists would need to go through and get the authorization. Unless PSYPACT doesn't require that. Now, the organization you're working for may have something extra they want you to do, but PSYPACT is based on the individual psychologist.
There was a question, do you have to have a traditional license in the state that you use as your home state, or can it be any compact state? But I'm not quite clear on what is meant by a traditional license. So I don't know if whoever posted that question, it's listed as anonymous, can clarify, because I'm not sure. Janet, I don't know if.
I don't, it does have to be a licensed at a doctoral level in a PSYPACT state. A temporary license in that. So if you got a temporary license through COVID or something like that during when they were issuing some of those temporary licenses, that would not qualify. It has to be an official, full license in a compact state that you declare as your home state that you would be sitting in. But I'm not sure what traditional, that's how I define this traditional license. I don't know.
So there is a follow-up. If I'm licensed in Connecticut and I travel to Massachusetts or New Hampshire, so temporary, like if you're traveling for, vacation or something very brief, can you do telehealth with a patient as part of PSYPACT?
Okay, so that would not be part of PSYPACT because you're outside of your home state. But what you can do is, because especially if you're, so let's say you're licensed in Connecticut and you're vacationing, and you want to still see one of your Connecticut patients, you would need to contact the licensing board for the state that you're vacationing in and see if they consider that practicing in their state. Some states do, some states don't because the patient's not in that state, but it varies state by state, unfortunately. And some would consider that practicing in their state and could consider it practicing without a license in that state, but you can check with their licensing board.
Okay, so that would be a state-by-state issue.
Yeah.
Can I do telehealth from a PSYPACT state into my home state?
Only if you're licensed in that other PSYPACT state and have changed it to be your home state.
Okay.
So example to use is that you are licensed in Minnesota and Arizona, and you spend the summer in Minnesota and the winter in Arizona. You can change your home state for that 6-month period. And while you're in Arizona, you're practicing under Arizona as your home state, but you still have to be licensed in both of those states.
I heard that Connecticut allows psychologists to be in another state and do telehealth when we're out of state, as long as the patient is in Connecticut. Is that law separate from PSYPACT and would therefore allow us to practice when we're out of town? That might be a question for Connecticut, right? For DPH. Janet, what do you think?
It still seems like Connecticut may not have a problem with you practicing telehealth into your patients in there, but that state you're sitting in may have a problem with it. So I don't know that, but I do think that's probably a question that to address that Connecticut part of it. But I still think you're going to need to talk to the state board of whatever state you're sitting in.
Okay. So you'd want to
see anybody get in any trouble.
You'd want to clear that with both states, it sounds like.
Yeah. It's always better to be safe.
Absolutely. I was told by somebody who holds an e-passport that you're limited to 30 sessions under PSYPACT. Is that accurate?
That is not accurate. That, I think they're confused with the 30 days of the temporary in-person face-to-face. There is no limits on the e-passport and APIT telepsychology part.
Okay, sorry, there's a whole bunch of questions. Just want me to keep going. They keep coming in. It's good. It's important. Can you travel to another state who's located? No, okay, I actually think we answered that. I think that's a duplicate. Would PSYPACT allow conducting a psychologically based program from the home state with clients in various other PSYPACT states?
I'm not sure I understand that one. I'm sorry.
Carol, can you clarify? Are you talking about like a group to have people from different states or something like that?
All right, am I?
Yeah,
muted?
go ahead, Carol. Thanks.
Can you hear me?
Yes.
Oh, okay. Yeah, like if you're conducting something where you're offering like a group-based like a group-based psychotherapy group. And you have clients in various states. So you're doing group psychology, group program related to depression or anxiety or something like that. Could you be sitting in home state Connecticut and there's some participants from other states who are part of PSYPACT?
As long as all the other, so all of your patients are in various states. So you would
Right.
have somebody in Georgia, Tennessee, Alabama. Okay. As long as they are sitting in PSYPACT states, then yes, you can
Okay.
do that. As long as you're in your home state.
Great, thank you.
Thanks, Carol. Okay. If your group practice is in New York and that's where billing comes from, but you're practicing in Connecticut with a Connecticut license, should your Connecticut license have your home address rather than the group practices office?
That's an interesting question. We only look at where you hold your license and what you declare your home state. I mean, you put your demographics in and you would put where your work address and your home address or whatever. But if you're physically working from Connecticut, that's what we would be looking at in your license there. I'm not sure how the billing out of New York works. That's I don't know. I'm not sure about that. I would, if the person that posted that would email me and let me do a little research on that one, and I will let you guys know what I come up with. I'm not sure because you're looking at billing coming from a non-PSYPACT state, and I'm just not sure how that works.
Okay. All right, Laura said she would send an email.
Okay, thank you. I think it should be okay because we say practice takes place where you're sitting, but I'd like to verify that. I haven't had that question before.
Is a consent order in one state a rule out for licensing? When is a matter of conduct cited considered off of a doctor's record?
So for PSYPACT, if you have ever had a disciplinary action, that would be considered a grounds for not getting authorization under PSYPACT. Part of that is because, if you have a discipline, licensing boards can review that before they issue a license. But because of the way PSYPACT is structured, once you get that authorization, you can go into any of those states and they don't get to issue a license or seek. So the way it was structured is that any disciplinary action, and right now it doesn't go off, it would still be there if it was considered an adverse action that was a publicly reported disciplinary action that is on, that was reported by a licensing board.
I don't think you're going to have a clear answer for this one, but any guess on how long it will take New York to join?
it's interesting because the bill that got introduced and it's very, I wish we could have done all of them this way. It's not even really the PSYPACT language. Like I said, the bill is very long, and if you ever have some issues and can't sleep, it's great reading. But the New York bill, and they did the same thing for nursing and medicine, just says this joins PSYPACT, and it's like a sentence, and it's like, well, that's great, but it really doesn't. And so we're working with them to get that going forward. The fact that they don't have any compacts is, usually that's a little harder. Most of the states have one or two of the licensing compacts, so you kind of have something to work with. I do think the fact that nursing and medicine are being introduced as well, and they have, a lot more numbers than we do. And if they can get the door opened, I think we can go in, we because of the need for mental health services, we're seeing that. But if somebody with a little more muscle gets us in, really hoping next year that we'll see some movement. This year, none of them moved. They've all just kind of sat there, but hoping to see some movement and the proper bill get introduced next year. Sometimes it takes a while, sometimes Delaware, quickest one ever, I think they did it in 2 weeks. Never seen a bill go through that fast. Rhode Island came on this year after 7 years of trying. So, sometimes it takes a little longer and sometimes it can be really fast. You get the right group at the right time. So
I think for us, it took a couple years too. Like it was on our legislative agenda for, 2 to 3 years before we got it through.
Yeah. And then did the study, which I think helped a lot going through. So, and we're seeing that in some of the other jurisdictions where they're having some studies and they look at all the compacts. And I think that's actually, I think Wyoming is doing that right now. We're on a summer study out there to hopefully see if we can get some legislation in next year.
I think that's everything. Derek, anything on your end or anything that I didn't catch? All right, hold on. One more just popped up. Will the renewal date always revolve around each psychologist's initial APIT date? Is there an advantage financially to waiting until 2023 to apply?
It will be on your issue date. It'll be 1 year after the issue date. Right now, it would be on the APIT. So let's say if you opened your application in October 1st, when you can get it through, and 6 weeks later, we finish it up and that's perfect and everything goes through, you would have 1 year from that date to go forward. So if you want to start it in 2023, that would be fine. You're still going to be based on 1 year from that date. The only time it might change is if somewhere down the road you inactivate it and it stays inactive for a while. When we reactivate it, your renewal date would change to whatever date we reactivate. But other than that, it should stay at your APIT issue date.
And then are unlicensed providers eligible for this if they're under supervision of a PSYPACT provider? Okay.
No, it has to be this. It's only for the PSYPACT or for the psychologist themselves, not any supervisees under there.
Okay. Now I think we're done. Yeah, October 1st, right? Nobody can, perfect. Derek, I see you have that.
Right. If you want to go ahead and order your, because you're so close, if you want to go ahead and order your transcript and start a credentials bank record, we can upload your transcript to that if you want to do that. Because the transcript seems to be the slowest part of getting the application done, just getting it there and all that, especially if you come from a university that doesn't do the electronic version, that they want to do it by mail, can go ahead and send those in if you want to do that.
All right. Somebody up there, it looks like we have one raised hand. Hold on, I'm trying to find where that. Okay. Rachel, I'm trying to unmute you. I see that you have your hand up. Derek, do you see it? I thought I saw someone with a hand up, but now I'm not seeing it anymore.
Yeah, I saw it, but then it went away. I don't see it anymore either.
Okay. And Janet, somebody said, could you share the mailing address one more time for transcripts?
Okay, it is ASPPB at PO Box 849, and that's in Tyrone, Georgia 30290. And that's for the physical mailing. If your university will electronically send them, it's just transcripts@aspppb.org.
And then there were just some questions about when we'll get materials out. So I think hopefully by the end of the week, definitely as soon as possible. Our executive director might be able to send everything out, tomorrow, but hopefully by the end of the week. So we will get the recording and the materials out to everybody within a few days.
I don't think I have sent you my slides. I'll email them as soon as we're done so that you have
Thank you.
those. You're welcome.
Thank you so much for your time and for answering all of our questions. There's comments coming in the chat about how wonderful it was, how helpful it was. So I think people are really appreciative both of this opportunity and an option for Connecticut providers now, and also to you for your time and willingness to follow up as needed with questions and things.
Well, thank you very much for allowing me the time to go over all of it, and I hope it was helpful. I know sometimes I go a little fast, so I hope I didn't go too fast. If you think I live in Georgia, I'm supposed to talk slow, but somehow or another I forgot that part when you live in the South. But my email will be on the materials when they send them out, so please feel free to email me with any questions, and like I said, if you get in part of the application process, I'd like to be as helpful as I can. So, and we are very excited that you guys are joining us, and we can't wait for October 1st.
Thank you. And for our CPA members too, our professional affairs committee, is available to answer questions on an ongoing basis, about this and any other issues or practice needs or questions that you might have. So we're also here to answer questions about anything as you all need.
Thank
All
you.
right. Thank you so much. Thank you to everybody in the audience for attending and participating and for your questions. We look forward to getting many people enrolled in PSYPACT in the coming year.
Good. Thank you. Have a nice
Good night.
evening. Good night.